Today, I'm going to share the specific colon cancer warning signs that become increasingly important once you hit 40, because this is when your risk begins to climb significantly, and unfortunately, this is also the age when many people start experiencing changes in their digestive system that they dismiss as normal aging, but could actually be early signs of colon cancer. And we absolutely need to talk about this, because colon cancer doesn't just happen overnight, it develops slowly over years, and the changes that start appearing in your 40s could be your body's first attempt to warn you. And here's what makes this so urgent. After age 40, your risk of developing colon cancer doubles approximately every 10 years. So while your risk at 40 might be relatively low, by the time you reach 50, it's doubled, and by 60, it's quadrupled. And according to the American Cancer Society, about 90% of colon cancer cases occur in people over 45, which means that your 40s are the critical decade when you need to start paying serious attention to your digestive health and any changes that might indicate developing problems. And what's particularly concerning is that many people in their 40s are so busy with career demands, raising families, and managing the stress of midlife that they ignore or rationalize away symptoms that could be early warning signs of colon cancer, and they often assume that digestive changes are just part of getting older or are related to stress diet or lifestyle factors. And this delay in recognizing and addressing symptoms can be the difference between catching colon cancer early when it's highly treatable and discovering it at an advanced stage when treatment becomes much more difficult. If you're over 40, please share this important information with your friends and family. Early recognition of these warning signs could save your life or the life of someone you care about. And before we dive into this life-changing information, don't forget to hit the notification bell and subscribe to our channel. If this video resonates with you, type 1 in the comments below. If not, type 0. Before we dive into the specific signs, let me explain why your 40s are such a critical time for colon cancer development. So colon cancer typically begins as small polyps or abnormal growths in the lining of your large intestine. And these polyps can take 10 to 15 years to develop into cancer, which means that the polyps that might become cancerous in your 50s or 60s are likely starting to form right now in your 40s. And during this slow transformation process, your body may start sending subtle signals that something is changing in your digestive system. But because these changes happen gradually over many years, they're easy to overlook or attribute to other factors. And this is why understanding what to look for in your 40s is so crucial for preventing colon cancer from progressing to advanced stages. Now, the first warning sign that's particularly important for people over 40 is what I call the midlife bowel shift. And this refers to changes in your bowel patterns that coincide with entering your 40s, but aren't necessarily related to diet stress or lifestyle changes. So maybe you've always been regular with daily bowel movements, but now you're going every other day, or maybe you used to never have issues with constipation, but now you find yourself straining more often. And what's happening is that as we age, our colon naturally becomes less efficient at moving waste through the system. But when these changes are more dramatic or happen suddenly, they could indicate that polyps are beginning to form and interfere with normal bowel function. And the reason this is so important to recognize in your 40s is that this is often the very first sign that something is developing long before you'd have any other symptoms. And many people in their 40s assume these changes are just part of getting older or are related to their increasingly sedentary lifestyle or work stress. But if you notice significant changes in your bowel habits that persist for more than a few weeks, especially if they represent a departure from your lifelong normal pattern, that's something you need to discuss with your healthcare provider. Okay, the next warning sign that becomes crucial in your 40s is what doctors call subclinical anemia. and this is when your iron levels and red blood cell counts start dropping, but not enough to cause obvious symptoms like severe fatigue or weakness. And this happens because developing colon polyps, even benign ones, can cause microscopic bleeding that you can't see, but that slowly depletes your iron stores over months or years. And the reason this is particularly relevant for people in their 40s is that this is when many people start experiencing what they assume is normal midlife fatigue, or feeling like they don't have as much energy as they used to, and they attribute this to work, stress, lack of sleep, or just getting older. But if this fatigue is actually caused by slow iron loss from intestinal bleeding, it's an early warning sign that needs investigation, and for women, this can be particularly tricky to recognize because they might assume that any iron deficiency is related to menstrual periods. But if you're a woman in your 40s and you develop iron deficiency anemia that seems disproportionate to your menstrual flow, or if you're a man over 40 with any degree of iron deficiency, that should trigger an evaluation for possible bleeding in your digestive tract. Another warning sign that's especially important in your 40s is what I call appetite architecture changes, and this refers to subtle shifts in how your appetite and eating patterns work. So maybe you used to feel hungry at predictable times throughout the day, but now your hunger is irregular, or maybe you used to be able to eat larger meals, but now you feel full more quickly, or maybe foods that you've always enjoyed now seem less appealing or cause mild digestive discomfort. And these changes happen because developing polyps or early tumors can affect the normal signaling between your digestive system and your brain that controls hunger and satiety, and they can also cause low-grade inflammation that affects your taste preferences and appetite regulation. And because these changes are so subtle, and because people in their 40s often experience stress-related changes in eating patterns, anyway, these early warning signs are frequently overlooked. But if you notice persistent changes in your appetite or eating patterns that can't be explained by stress medication, changes or other obvious factors, especially if they're accompanied by gradual, unintentional weight loss, that's something that warrants medical evaluation. Now let's discuss a warning sign that's particularly relevant for the busy lifestyle that many people in their 40s lead. And that's what I call stress symptom camouflage. And this is when early colon cancer symptoms perfectly mimic the digestive effects of the chronic stress that's so common in midlife. So you might experience intermittent abdominal cramping, occasional changes in bowel habits, mild nausea or general digestive uneasiness, and because people in their 40s are often dealing with significant stressors, like demanding careers, teenage children, aging parents, financial pressures, and relationship challenges, it's natural to assume that digestive symptoms are stress-related. But here's the crucial difference. Stress-related digestive symptoms typically fluctuate with your stress levels and improve during relaxing periods like vacations or weekends, whereas early colon cancer symptoms persist regardless of your external circumstances. So if you notice digestive symptoms that you initially attributed to stress, but that don't seem to correlate with your actual stress levels, or that persist even during low-stress periods, that could be a red flag that something more serious is developing. Another warning sign that becomes increasingly important in your 40s is what gastroenterologists call the exercise intolerance shift, and this refers to a gradual decrease in your exercise tolerance or physical stamina that seems disproportionate to your fitness level or activity patterns. So maybe you used to be able to climb stairs without getting winded, but now you find yourself breathing harder, or maybe your usual workout routine feels more challenging than it used to. And while some decline in physical performance is normal as we age, if this decline seems more rapid or severe than expected, it could indicate that you're developing anemia from chronic microscopic bleeding in your colon. And the reason this is particularly important to recognize in your 40s is that this is when many people start becoming less active anyway. So they might not notice that their decreased stamina is actually a medical symptom rather than just a result of lifestyle changes. So if you're experiencing unexplained fatigue or exercise intolerance, especially if it's accompanied by other subtle digestive changes, it's worth getting evaluated to rule out underlying medical causes, including possible bleeding in your digestive tract. Now, here's a warning sign that's often completely missed in people over 40, and that's what I call the sleep disruption syndrome, and this refers to changes in your sleep patterns that seem unrelated to stress work schedules or other obvious factors. So maybe you've started waking up more frequently during the night, or you're having trouble falling asleep, or you're waking up feeling less rested than you used to. And the reason colon cancer can affect sleep is that developing tumors can cause subtle inflammatory responses that interfere with normal sleep architecture, and they can also cause mild discomfort or digestive disturbances that disrupt sleep, even if you're not consciously aware of them. And because sleep problems are so common in people over 40 due to hormonal changes, stress, and lifestyle factors, sleep disruption as an early cancer symptom is rarely considered, but if you notice significant changes in your sleep quality that coincide with other subtle digestive symptoms or that don't seem related to obvious factors like stress or hormonal changes, it could be worth investigating further. Another warning sign that's particularly insidious in your 40s is what I call the medication masking effect. And this happens when early colon cancer symptoms are inadvertently suppressed or disguised by medications that many people start taking in their 40s. So if you're taking antacids for heartburn or acid reflux, those medications might mask early symptoms of bleeding or inflammation in your colon. Or if you're taking anti-inflammatory medications for joint pain or headaches, those drugs might reduce the inflammation that would otherwise alert you to developing problems in your digestive system, and pain medications, whether prescription or over-the-counter, can mask abdominal discomfort that might be an early warning sign. And because people in their 40s often start taking more medications for various age-related health issues, this masking effect becomes increasingly common. So if you're taking any medications regularly, it's important to pay attention to any digestive symptoms that persist despite treatment, and to discuss with your healthcare provider whether your medications might be masking underlying problems. Now let's talk about a warning sign that's especially relevant for women in their 40s, and that's what gynecologists call pelvic symptom confusion, and this refers to digestive symptoms that mimic gynecological problems or vice versa. So you might experience pelvic pressure or discomfort that you assume is related to approaching menopause or reproductive issues, but that could actually be caused by developing problems in your colon. And this happens because the colon sits very close to the reproductive organs in the pelvis. So as polyps or tumors develop, they can cause pressure or discomfort that feels like it's coming from your ovaries or uterus. And conversely, the hormonal changes that happen during perimenopause can affect digestive function in ways that might mask early colon cancer symptoms. So if you're a woman in your 40s experiencing pelvic discomfort, irregular periods, or other symptoms that seem gynecological in nature but don't respond to typical treatments, it's worth considering whether some of these symptoms might be related to your digestive system. Another crucial warning sign for people over 40 is what I call the family history activation, and this refers to the fact that if you have a family history of colon cancer, your risk becomes significantly elevated once you reach your 40s, and you need to be especially vigilant about any digestive symptoms, no matter how minor they might seem. So if you have a parent, sibling, or other close relative who had colon cancer, especially if they were diagnosed before age 60, your own risk is substantially higher, and symptoms that might be dismissed as minor in someone without a family, history should be taken much more seriously in your case. And this is also when you need to start screening earlier than the standard age of 45. And it's crucial to have detailed conversations with your family members about their health history, because many people don't know the specifics of their relatives' medical conditions, and this information is vital for assessing your own risk level. Now let's discuss a warning sign that's particularly relevant for the hormonal changes that happen in your 40s. And that's what endocrinologists call the metabolic shift syndrome. And this refers to changes in your metabolism, appetite, and weight that seem related to hormonal fluctuations, but could actually be early signs of colon cancer. So maybe you're experiencing unexplained weight loss or gain that doesn't correlate with changes in your diet or exercise habits, or maybe your appetite has changed in ways that seem hormonal but don't respond to hormone replacement therapy or other treatments. And the reason this is so important to recognize is that both perimenopause in women and andropause in men can cause metabolic changes that might mask or be confused with early cancer symptoms. So if you're experiencing metabolic or weight changes that seem disproportionate to your hormonal status or that don't respond to appropriate hormone treatments, it could be worth investigating other possible causes, including developing colon problems. Another warning sign that becomes increasingly important in your 40s is what I call the stress test phenomenon. And this refers to how your digestive system responds to physical or emotional stress, and whether that response has changed from your earlier adult years. So maybe you used to handle stressful periods without any digestive symptoms. But now, stress seems to trigger more pronounced digestive upset. Or maybe your digestive system used to recover quickly from dietary indiscretions or stomach bugs. But now, it takes longer to return to normal, and these changes in stress resilience can indicate that your digestive system is dealing with underlying inflammation or dysfunction that makes it less able to cope with additional challenges. And because stress management becomes increasingly important for overall health in your 40s, many people focus on stress reduction without realizing that their changing stress response might actually be a symptom of an underlying medical condition. Now, here's something that's absolutely crucial for people over 40 to understand, and that's the concept of cumulative risk. And this means that all the lifestyle factors that might increase your colon cancer risk begin to have more significant effects once you reach your 40s. So if you've spent years eating a diet high in processed meat, having a sedentary lifestyle, smoking or drinking alcohol excessively, the effects of these risk factors compound over time, and your 40s are when these cumulative effects start to manifest as actual increased cancer risk. So even if you've never had any digestive symptoms before, your 40s are when you need to start being much more vigilant about any changes in your digestive health, because your baseline risk is now higher than it was in your younger years. And this is also why your 40s are the perfect time to make aggressive lifestyle changes to reduce your colon cancer risk. So increasing your fiber intake, getting regular exercise, maintaining a healthy weight, limiting alcohol, and avoiding tobacco can all significantly reduce your risk. But the earlier you make these changes, the more benefit you'll see. Now let's talk about the screening recommendations that are specifically relevant for people in their 40s. So the current guidelines recommend starting colon cancer screening at age 45 for people at average risk. But if you have any of the risk factors we've discussed, or if you're experiencing any persistent digestive symptoms, you may need to start screening earlier, and there are now multiple screening options available, including colonoscopy, which remains the gold standard, but also stool-based tests that you can do at home that check for hidden blood or abnormal DNA that could indicate colon cancer or precancerous polyps. And the key is to choose a screening method that you'll actually follow through with consistently And if you have a family history of colon cancer, you should start screening at age 40 or 10 years before the age at which your youngest affected relative was diagnosed, whichever comes first, and you may also need more frequent screening than people at average risk. But beyond formal screening, it's crucial that people in their 40s develop what I call digestive self-awareness. And this means paying attention to your normal patterns and being alert to any changes that persist for more than a few weeks. And don't be embarrassed to discuss digestive symptoms with your healthcare provider, because catching colon cancer early can literally save your life. And remember that many of the lifestyle factors that increase colon cancer risk are completely within your control. So maintaining a healthy weight, eating plenty of fruits, vegetables, and whole grains, getting regular physical activity, limiting red and processed meat, avoiding tobacco, and limiting alcohol consumption can all significantly reduce your risk. And if you're in your 40s and haven't had a serious conversation with your healthcare provider about colon cancer screening and prevention, now is the time to do that. And don't wait until you have symptoms, because by the time colon cancer causes obvious symptoms, it may have already progressed to advanced stages. So I hope this information helps you understand why your 40s are such a critical decade for colon cancer awareness and prevention. And please share this video with your friends and family who are over 40, because early detection and prevention are the keys to beating this disease. And subscribe for more age-specific health content that can help you navigate the unique health challenges of each decade of life. And I'll see you in the next video, where we'll discuss the most effective colon cancer prevention strategies specifically tailored for people in their 40s and beyond.